In 2028, I was accepted in the Columbia University Psychiatric Residency Program. I worked with a diverse team of faculty and other residents who also trained to become psychiatrists. In 2031, I finished my training and got my board certification. In my first year of residency training, I worked in a hospital with patients who had a wide range of medical illnesses. Then I spent 3 years as a psychiatrist in training, learning the diagnosis and treatments of mental health, which included various forms of psychotherapy and the use of psychiatric medications. The training took place in inpatient, outpatient, and emergency room settings. My education and clinical training helped me understand the complex relationship between emotional and other medical illnesses and their relationships with genetics and family history, to evaluate medical and psychological data, to make diagnosis, and to work with patients to develop treatment plans. I analyze and evaluate patient data or test findings to diagnose the nature or extent of their mental disorders. I prescribe or direct treatments or medications to treat mental, emotional, or behavioral disorders for problems such as panic attack, hallucinations, thoughts of suicide, hearing voices, sadness, hopelessness, and anxiety. It's a common misconception to confuse both careers. Contrary to a psychiatrist, a psychologist does not need to go to medical school. As a physician, psychiatrists can order or perform a full range of psychological tests, as well as prescribe medications. The skills required to become a psychiatrist are empathy and compassion, emotional resilience, the capacity to monitor developing situations and anticipate issues, analytical and a scientific approach, as well as good leadership and problem-solving skills. My bachelor's degree in public health at the University of Florida cost me about $25,500. I spent approximately $131,000 on medical school, which totaled to $156,500, for which I paid with the help of student loans. And during my residency, I got paid around $40,000 a year. I have a private practice in Orlando, and I see patients on a daily basis. I work long hours, and I always have to have my phone on me in case of an emergency. My average income is around $200,000. Thank you for joining our career fair. I hope I gave you more insight on my job and the path I took to get where I am.